Well, welcome everyone. I am here today with Rachel Whitfield. Rachel is a nurse practitioner at Children's Mercy Teen Clinic in Kansas City and the Title X program manager. So thanks for talking with me today, Rachel. I have just a couple questions for you about accessing care. So my first one is it still important to get care right now, especially considering the whole COVID-19 situation in the community?
It is absolutely vital that we're still seeking care. Just because it feels like the world's come to a screeching halt, our lives have not, and our patients' lives have not. And so it's really important for us to still be offering care and providing care to those who find that they need it. And not only just reproductive health services, but physicals, immunizations, mental health services, all of those things are vitally important right now.
All right, and from what I know, you're offering all of those things. So if someone needs to get care and they're a teen, or if they need to refer a teen or get an appointment for a teen in their life, how would they do that?
So it's very simple. They can call 816-960-3050 and request an appointment. They will talk to one of our schedulers, potentially one of our nurses, who will find out what you're needing or what the client is needing and get them scheduled in the appropriate space, either an in-person visit or a telemedicine visit, depending on how comfortable they are with whichever visit we want to schedule them in that day.
All right, so if someone is really nervous about exposure to COVID-19 or they have some barriers to getting to services, it sounds like there is opportunity to get telemedicine from your clinic.
Yes, absolutely. We have both options available. Again, sometimes depending on what we're seeing you for, we may have to see you in person, which we have lots of protocols in place to keep you safe if we are to see you in person, but we definitely have a lot of telemedicine visit options. And if someone has any high risk diseases like asthma or any lung conditions or heart conditions, or if they're just really uncomfortable, we're happy to schedule a telemedicine visit as kind of a consultation, and we'll do everything we possibly can to do everything remotely if we can.
So what does a visit look like right now if they do come or if they make a telemedicine appointment? And then is there anything they need to do to prepare to come visit with you all?
Great. So if we are to see you in person, what we would do is schedule you an appointment. We're scheduling at a lower capacity than we normally would, so there'll be less people in the clinic. We're doing an expedited check-in process, so we'll try to get you back to a room as quickly as possible. When you show up, what will happen is we'll meet you on the first floor. We'll ask you some screening questions to make sure that you're not having any symptoms or that you haven't been exposed to someone who's tested positive for COVID. And then we'll take your temperature with a no-touch thermometer. We're also asking that you wear a mask and keep a mask on the entire time and limit the number of visitors that you bring with you. You'll come up to the clinic floor, you'll check in on a computer there, and then we'll call you back to the room as quickly as possible. If you are scheduled for a telemedicine visit, what will happen is we will email you a link to a visit on Microsoft Teams, which is very similar to Zoom. At the appointment time that's listed in your email, a nurse will meet you on that phone call and ask you some questions about your medical history, what medications you take, kind of the typical questions that you would have. They would ask you, find out a little bit more about what your appointment's for today, and they'll connect you with a doctor or nurse practitioner. As far as preparation, there's not a ton of preparation you need. Just be ready to share those medical things and just allow yourself enough time. Try not to be driving if it's a telemedicine visit, and just try to be able to be available is the biggest thing. You might want to have your medical history written down, your medications written down, things like that. That's it.
All right. So do you have any parting advice or words of wisdom for someone who needs your services at this time?
Yeah, so our biggest thing is just don't hesitate, don't be afraid to reach out. We know that it's a strange time, and we know that everything can feel kind of overwhelming right now because it's all so new. but we will do our best to make the visit, setting up the visit and coming to the visit, whether that's virtually or in person, as easy as possible. And again, we offer reproductive health visits, but we also offer sports physicals, an annual physical, especially if you're needing immunizations to go back to school, or just you're due for your immunizations, we can get you in for those things. And then we also offer some mental health services. It's a hard time, and we know that a lot of people are struggling with not being able to connect with friends or family, or just a lot of fear for either yourself getting sick or someone that you care about being sick. And so we also have mental health services. And so just don't be afraid to reach out, give us a call if you have questions. And again, we're trying to make the process as easy as possible.
All right. Well, thank you for all of that helpful information and advice. And I will talk to you again soon.
Thank you. Bye.